guys. Hello. This is Jose Vazquez for Baseball Strong. Welcome to the next episode. Before we begin, I'd like to start out with some advice for baseball high school players, baseball parents, baseball coaches. So today I want to talk about growth plate injuries in middle school and high school athletes. But what I really want to the people I really want to talk to are the parents, because as parents, when we hear certain diagnoses and we are told that our child has something, we tend to worry. And so right now, I'm starting to see a lot of kids with shoulder, elbow pain. It is that time of the year. High school baseball season, middle school baseball is beginning. And because the reality of it is, we go from low level baseball activity to very, very high intense baseball activity. And so I'm beginning to see a lot of kids come up with shoulder and elbow pain. And I'll speak from experience first and kind of give you some tips about how to go about this, what things to look for, what things to do. But, as a parent, I have a high school baseball player. And in my experience, I think to myself, we're doing all the right things. We're training, we're doing all the shoulder rehab, we're doing all the right things, trying to get him to sleep well, eat well, practice with the right intensity. But yet, he pitched last Friday and he has shoulder pain. At first, I thought, it's just a muscle strain and he'll get over it and we'll get through it. We'll be ready for next week. Well, a week went by and the pain was still there. So I took him to the doctor and we got some x-rays, and it turns out he's got a little growth plate stress reaction, which on one end it tells me that he's still growing, which is a good thing. The bigger the better. That's a good thing. But the reality of it is that a lot of times when parents take their kids to the doctor and a doctor says your son has a growth plate reaction or a growth plate stress fracture of some kind of growth plate type of diagnosis, the most common advice that they get is no throw for 3 or 4 months. Shut him down, no throw, let it rest, don't do anything. And I've had some patients in the past that have been through that experience. And the one thing that I want to advise parents is that shutting down is not the right answer. Yes, you stop throwing because throwing is the irritating activity. But in order to promote the best rehab is to find a trainer, strength coach, physical therapist who is well versed in baseball injuries and begin a sound shoulder program, a program that includes core training, leg training, because the truth is, if you do nothing for 4 months, everything is going to get deconditioned. Your legs, your back, your core, your shoulder, plus, not to mention, the anxiety and the depression from the kid. You have a kid that is very active, that is constantly going to practice, and now he's told that he can't do anything.
Yeah,
I even had a patient that the doctor told him, just stay home and play video games. And I thought that was the worst advice I've ever heard. Because when it comes to rehab, pain should not stop us. Pain should not stop us from initiating some form of rehab. Yes. Now, let me take that back. The difference is whatever activity is causing the pain, yes, that has to be modified. And in this case, yes, if it was a throwing injury, if this growth plate stress reaction came from a throwing injury, yes, you will stop the throwing for a little bit. But as soon as you can, you need to begin doing shoulder exercises, posture correction exercises, core stability exercises, leg exercises. I even had a kid that he couldn't throw, but he could hit. So we kept hitting, kept the kid engaged, The kid was even able to be a designated hitter for his team, and the kid didn't lose any playing time. He did not throw for several months, but he stayed engaged. Mentally, he felt fine because he was still with his teammates and he was still participating in sport. So, parents, whenever you have shoulder or elbow pain, yes, take it serious. Take them to the doctor. If it's growth plate related, that's not the end of the world. Growth plates heal back with a proper physical therapy program. They will get back to throwing. It is not the end of the world. But shutting them down and doing nothing for 3 to 4 months is not the answer. So today, my baseball strong advice is for parents, whenever you run into a growth plate situation, shutting them down is not the answer. Get some help, get someone that knows what to do, and keep them going. Keep them exercising, keep them engaged, because in the long run, they're going to be better off by staying engaged and staying in shape. All right. So last night, Dr. Leek discussed anchoring. So today's topic, to kind of follow that up, is degenerative is not a prognosis. Now, I would say first thing, prognosis, I don't like that. I don't like that word, because degenerative is a diagnosis.
Wait a minute. So I gave the wrong thumbnail?
Yes.
Wow.
Yes,
Okay.
because prognosis is talking about the outcome. So if I have cancer, my prognosis is I have 2 years to live. ACL surgery, my prognosis, I should be able to get back to playing in 6 months. A Tommy John surgery, I should be back on the field in a year and a half. That's a prognosis. A diagnosis is, what is it? What is the cause of the pain? So let's get back on track. Degenerative. Degenerative is a general term. It is not a diagnosis. Many times I get patients and they have back pain, neck pain, knee pain, whatever. And I ask them, okay, tell me what your doctor told you. And their answer is, the doctor told me I have a degenerative disc. And so I feel like my responsibility as a therapist is to explain what degenerative means. And the point that I want to make today regarding the word degenerative means that it refers to wear and tear. From the age of 25 on, where we begin to lose muscle, when we begin to lose bone density, when we're starting to get out of shape, we're beginning to have more aches and pains. From that moment on, we're going to be degenerating until until the day that we die. Degenerative only means that you are wearing down. So when I get someone tell me I got a degenerative disc, yes, I understand that the disc has worn down. Now the vertebrae are a little closer together. And because they're a little closer together, perhaps they're compressing on a nerve that is causing pain. But degenerative is not the diagnosis. The diagnosis is nerve compression due to the proximity of the vertebrae being closer together. And so, unfortunately, when patients come to me with that word, degenerative, it's almost as if they become that word. And because that word implies that I'm wearing down, that I'm worn down, they feel like there's not much I can do because I'm worn out. My back is worn out. My knee is worn out. And that is further from the truth, because we're all wearing down. We are all suffering wear and tear. So in the case of a low back, that is degenerative. Okay? All that means is you're probably getting pain from the proximity of the joints, putting pressure on the nerve. So the treatment plan, the approach is to decompress the joint, to create some sort of traction on the vertebrae to alleviate the compression on the nerve root. If you have a degenerative knee, okay, so perhaps usually when you have a degenerative something, because most people own that and they accept it as a diagnosis or some form of disease, they quit doing stuff. So guess what happens? Your muscles atrophy. The muscles that support the joints, the muscles that support your back, they atrophy. So of course you are going to feel pressure and you're going to have pain because you have avoided doing exercise or moving a certain way because, quote unquote, you have a degenerative joint. And so there's nothing I can do. I just got to accept it. And so, my message to you, any chronic patient, any person out there that has been told that you have a degenerative so and so, all that means is that your joints are worn down. That doesn't mean that you can't strengthen the muscles around it. That doesn't mean that there are treatment methods to alleviate the pain by distracting the joint. That doesn't mean that there's ways to move. If I shift my weight one way and that creates pain, a little bit of relief, then I need to strengthen in that new posture. Oftentimes, when these things happen, the pain takes over and we adopt a posture to avoid pain. And so now we are creating another problem because now the muscles and the joints that were lined up a certain way now are shifted in a different direction, trying to alleviate that other pain. And then you create other areas of degeneration. So, physical therapy, strength and conditioning, regular exercise, all those are great forms to combat degeneration. The idea of exercise is always to overcome degeneration. As we get older, we are degenerating. Our organs are failing, our joints are wearing down, our muscles are atrophy. So you can't stop aging. We're all getting older, but you can slow it down. The way to slow down aging, the way to overcome degenerative joints is through consistent exercise, diet, sleep, proper supplementation. So when it comes to degenerative conditions, that is not the end. If anything, as long as the compression on a nerve is not too severe and you're not having numbness all the way down to your toes, it is very easy to work with if you can get past the mental block of this word degenerative. That is not an endpoint. Degenerative is just a generic term to describe the wear and tear of joints. And so, to all you out there who've been given that, you want solutions? Seek professional help from a well-versed strength and conditioning coach, physical therapist, the right doctor, the right nutritionist. A combination of all those things are the way to combat all those degenerative conditions. So, Kevin,
You know something?
do we have any questions
Well,
so far?
Before
Have I struck a
then,
nerve?
you struck my nerve.
Okay.
Because I'm listening to this and I'm kind of in awe. I'm in awe at the fact that I don't want to make clinicians sound any way lazy in any shape, form, or fashion. I'm also hearing from last night's show, Dr. Leaks, when we were talking about anchoring, one of the things that he brought up was that you shouldn't lead into your first visit with, well, I have, right? So, yeah, I've been diagnosed with fibromyalgia or something else. Anchoring yourself to whatever the previous diagnosis was. Let them do their job and let them figure out what's going on. That's what they're paid for, right?
Yeah.
But then when you're telling me that a doctor can give you a very basic general diagnosis called degenerative something, I don't want to make clinicians sound lazy, but that sounds like somewhat of a lazy diagnosis, if that makes any sense.
My first response to that would be yes. I feel like the medical system is very quick to give answers.
Right.
And my personal opinion is that because I've been to doctors where I go to the doctor and they see me for 5 minutes and they just, they give me their diagnosis and they go on and they see, 20 other patients after me. And I don't want to say that they're lazy because I know sometimes they're experienced enough to know exactly
Correct.
what it is and they've seen it 20 million times and they're like, this sounds like a degenerative disc. Okay, I get that. But I feel like in the rush of answering questions, we can sometimes leave people empty handed, so to speak. A degenerative disc answer or diagnosis, in my opinion, is incomplete
Right.
because a degenerative disc might be the reason why the vertebrae and the joints are compressing and it's causing you pain. That might be the reason. But the dysfunction might be impaired mobility. This person cannot walk. This person cannot lay down. This person cannot sit. This person cannot drive. So there's a lot of dysfunction that is the real problem. So the degenerative disc is not the problem because you can't change that. Once you have a degenerative disc, it is there forever.
Really?
Yes, unless it is so compressed that it's damaging the nerve. Yes, there are surgeries to they insert artificial discs and they open up the joint and decompress the joint. So I know that there are surgeries to decompress the nerves. But in my opinion, those are severe cases because the compression is so severe that is putting so much pressure on the nerve that they're going to lose function of the leg. However, it is not the real problem. The real problem is that this person cannot walk for very long, cannot sit for very long, cannot sleep because they have so much back pain. And so what sometimes I feel like needs to be followed up with is you have a degenerative disc and it's causing your pain in your leg and it's causing pain in your hip or back. But the main problem is the fact that you can't walk. And the fact that if you can't walk and you don't have good balance and you fall and you break your hip or you break your femur. So the degenerative disc is perhaps the cause of the pain, but the problem really is the dysfunction that it brings with it. So as far as the clinicians, we're all human. Sometimes we make quick judgments. Sometimes we don't give the patient all the information. Perhaps like Dr. Leek was talking about anchoring, when the patient comes, I have this. From my standpoint, I look at that as like, okay, this person is anchored on that diagnosis. I feel like my first course of action is to diffuse that idea, to get that person to think differently, to explain what degenerative means, to explain the cause of pain, to explain why this whole thing is a problem, but that is not really who you are, and that is not really a diagnosis that you should anchor yourself to. Because I know many people with degenerative disc, and there have been studies where they've taken MRIs of healthy people with no low back pain, and they have degenerative discs, and they're asymptomatic. They have no pain at all. But then you get others that they got a little pinch, they got a little herniation, and they can't walk. Even in the major leagues, speaking of degenerative, when you're playing the big leagues for 10, 12 years, you're going to have degenerative shoulders.
I bet you degenerate hard.
Yeah. The shoulder joint gets really worn out. The rotator cuff gets really worn out. And I've known players with full thickness rotator cuff tears that pitched at a high level. They tolerated the pain. They were able to play through it. And I've known guys with minimal rotator cuff tears, just a minor micro tears, whose pain was so great they couldn't pitch. So when it comes to degeneration, it's relative to everyone. Do you want to anchor yourself to that diagnosis and become immobile and dysfunctional? Or do you understand that you can move with this? You can exercise with this. You can have a productive life with this. I've seen it at high level sport where degeneration was not the end for most of these guys. So when it comes to this idea, I feel like our responsibility as a clinician is to help that patient let go of that anchor. Take that anchor, pull up that anchor. Get away from that idea that, I have degenerative disc, my back is shot. No, it's not. There's a lot more that we can do, and there's a lot that can be done with this situation. It's not the end of the world. So,
real quick. Speaking on what you can do, I wanted to stop there real quick. So, what about those teeter totters or teeter hang-ups or, the inverted swings?
Yes.
Throw your feet in the air?
Yes.
Right. What do you recommend for that? Or is that even one of the fixers?
Yeah. So, okay. Degenerative disc, like I said earlier. So a degenerative disc is a disc that has lost its fluid and is now thinner, and now the vertebrae are closer together. Well, if you think about something that is compressing on the nerve, well, if it's compressing, then you want to distract it. One simple way you can do that at home is those teeter-totter machines that you can buy anywhere. That is a very good solution for self-care that you can have at home. We had it in the weight room.
Really?
Many of the guys that had back problems would hang on that for for a few minutes every day. Guys that have degenerative hips, you hang upside down and it causes distraction of the lumbar spine, of the hip joints. And so one of the treatment approaches for anything degenerative is distraction. If it's a knee, well, we try to distract the knee to open up the joint. If it's a shoulder, we try to distract it and stretch it to distract and get that pressure away from the pain area. So that is a very good solution for self-care. Yeah, it's a very inexpensive way to work on degenerative problems.
Interesting. Because we have Judy here. She says, I'm really struggling with muscle weakness. All right. And this is in her bottom. She's been doing targeted PT for the glutes, performs IT band abductors or abductions or abductors, and I'm still struggling with muscle tightness. So is that more of a stretch thing, or is that, obviously there's some sort of degenerative situation there as well, but.
Yeah. So I would say that muscle tightness could be when we exercise, obviously we create a little bit of inflammation, which may be triggering a little bit of that degenerative compression. And as a mechanism of the body to protect itself, it tightens up. So when we exercise and we have some of these conditions, it could be that the body is trying to protect itself and it contracts around the area. And so that might be creating the tightness. So I would say the other part about stretching and flexibility work. Flexibility changes day to day for many different reasons. One being a protective mechanism from the nervous system is detecting that nerve is being compressed, and so all the muscles around there are going to tighten up to protect it. So it could be a protective mechanism. Another thing, hydration. When we are dehydrated, our muscles become a little drier, a little stiffer. So that's another reason. So sometimes our diet could be a problem. Also, eating salty foods. If you eat a lot of salty foods, that can also dehydrate you. So that could be another reason. Or it could just be, muscle soreness from the workout. Sometimes we work out and our muscles are sore, and it's going to manifest itself in tightness. So tightness is not really a bad thing unless it's painful. but when it comes to flexibility, flexibility is one of those things that it changes day to day. And so my recommendation is always to try to stretch in the morning to get going and stretch at night before you go to bed. That to me, that's a simple way to kind of keep it going. But the greater idea is to understand that our flexibility is going to change day to day. So don't get disappointed or what's the word I'm trying to discouraged. Don't get discouraged if you had a good session yesterday and you felt really good. You wake up the next morning and you're tight. Don't be discouraged by that because it could just be a number of things. But now, if you have tightness for the rest of the week, okay, man, that may be a problem. But if you just wake up the next day and you're tight from the previous workout, but perhaps the day after that you're a little bit better, then perhaps it's just normal soreness from your workout.
Well, what about living with HEEDS, H-E-D-S?
I'm sorry?
HEEDS?
Not familiar.
I'm not either. I'm just reading it here in the chat. Same Judy. She says, I have HEEDS or heads, H-E-D-S. And that has instability along with it, I suppose.
Well, let's go with the instability.
Sure.
So instability, it's a different kind of problem. People that suffer from instability or hypermobility because they don't have a good sense of the joint range, they may feel that they're tight all the time. I remember having players that were very flexible, that their joints were very, very loose, and they were constantly complaining that they were tight. And they were constantly stretching. It's like, man, I feel tight. And they'll be stretching the hamstring, and the hamstring will be all the way past their head like a ballerina. And I'll be like, bro, you're not tight. You're just unstable. You have hypermobile joints.
That's funny that you just said that. That's exactly what they just said in the chat. So it's hypermobile Ehlers Danlos. Thank you, Judy. I appreciate that. Even if I don't know if I said it right at all, but yeah.
Yeah. So okay, let's talk about this concept of proprioception. So that is a term to describe how we feel our bodies in space. So like our self-awareness. So when I put my foot down and I reach down to the ground, and the reason I can maintain my balance is because my joints are sending messages to their brain to contract certain muscles and relax certain muscles to give the brain information where I am in space. Sometimes when people have very, very hypermobile or unstable joints, that message is delayed. It doesn't get to the brain as fast, and you feel unstable. So if I have a joint that is this, let's say that the joint is this close, I can probably control this. But if my joint space is this much, that's a long way to travel. That's a lot of space for the nerve endings and the proprioceptors in the joint to send messages to, hey, contract fast. I'm falling. I'm going in this direction. So the idea so to explain a little bit about hypermobility and instability, why that sometimes could be misinterpreted, is that the bigger the joint range of motion, the harder it is to control it. And that's where you're labeled hypermobile or unstable, because your joint space, your joint range of motion is far greater than the normal. And so your brain has a hard time controlling it. And so, unfortunately, people that are born with hypermobile joints, they have a hard time controlling their bodies, controlling certain body parts. I've seen it in players that were so hypermobile that they couldn't control their baseball swing.
So you have people that get to the big leagues that are this way as well?
Yeah.
Wow.
Yeah. Because, I remember we had this one guy that was really, really tall. Like, this guy was probably 6'6". But as he was, when he was younger, he was bigger than everybody, and he was able to dominate the game. because he was bigger and stronger. But as he got older and the game becomes faster, the reaction time is faster. So if I have really, really hypermobile joints and I'm trying to get a pitch that's 100 miles an hour, I have to be able to do all these movements with my body and stop them and redirect them in a certain sequence and a certain speed of movement. And if my joints are too mobile, in his case, I remember his hips would over rotate. And so because they would rotate so much, he could never get to the stopping position so that his hands would follow through and he was able to meet the ball. So at the big league level, he was never able to become a consistent hitter because he's always late.
Wow.
His swing was always late. He was always messing with his swing, trying to find the right feel for contact and stuff like that. And I always felt like it's not that he doesn't have hand-eye coordination, because he has that. It's just that in order to hit a baseball 100 miles an hour, your movements have to be so quick. One part moves really fast, the other one stops, the other one moves, the other one stops, and then you make contact. And so guys that are hypermobile tend to have difficulty at the higher levels.
Gotcha.
Unless the sport dictates it. For example, the swimmer, what's that famous swimmer that?
Phelps.
Phelps. Okay. His event is the butterfly.
Right.
Well, because that arm action is so high, it requires a lot of mobility. His hypermobility helps him.
Wow.
And that's why he's able to, get his arm in and out of the water with ease. Whereas somebody like me, I can barely reach back behind my neck. And so that would not be a good sport for me. So in his case, his hypermobility helped his sport. But in baseball, hypermobility doesn't help because the game dictates that you contract certain body parts in a certain sequence at a certain speed at a certain moment in time to hit a baseball.
So check this. I don't know if this is a controversial topic, even in the sports world or in the medical world. I know it has some controversy, but going back to the degenerative portions, what are your thoughts or feelings around stem cell treatment? Does that work with degenerative situations, degenerative discs, or even things in the hypermobility space? Because my understanding is that you're getting, I guess, pumped or injected with something that's going to help the area at which it's been injected.
Mm-hmm. I will say this. I have very limited knowledge of the actions of stem cells. But what I do understand is that the reason you get injected with stem cells is for those cells to come into the area and create a better healing environment. Mm-hmm. So to create healing in surfaces that are deteriorated, surfaces that are worn down, such as cartilage and some of the ligaments and some of those areas that are worn down. It is my understanding that stem cells are injected into these body parts to regenerate.
What about for nerve endings and stuff?
I'm not sure about nerve endings, but I would almost say that I don't think that the stem cells are not going to address instability.
Gotcha.
Because instability is just structurally, your joints are just so spread apart, or they have so much mobility that I don't think stem cells are going to shrink your joints. But I think stem cells are more for tissues to regenerate tissue. So that is my limited understanding with stem cells.
Sure. Do you ever run across people with very limited mobility type situations?
Yeah.
And what do you do to encourage them as to, life hits you hard, life can come at you fast. And now that you've been into a situation where now life is no longer the same, okay? Now we're doing these PT sessions. You're giving, little snippets of advice of, hey, this is what you can do at home on your own time. This is what you can do with me. When I'm at home, if I do a little bit of it, I'm still thinking in my head, life sucks right now. So like, what kind of advice do you give to people in these types of situations that are on the extreme side?
Yeah. Okay. So I would, first thing I would say, lack of mobility. I would take lack of mobility than instability. I think that I can work through tightness better than I can work through instability, because I think I can mobilize something more successfully than to stabilize something. Okay. Now, there are conditions like frozen shoulders and things where the joint capsule has calcified and has become brittle and it's stuck. Now, that would be more of a medical condition where you would have to go under anesthesia and a doctor will have to break that apart. So if it's not that, mobility, in my opinion, you can address mobility by regular cardiovascular exercise. The reason being, when you do, for example, you get on a treadmill or you get on a bike and you do light, continuous exercise, that creates an increase in body temperature. It creates an increase of blood pressure, blood flow. So all that body heat, all that blood flow is going to lubricate those joints. It's going to heat up those joints. It's going to heat up the body. So as we know, when you heat up something, you melt it. So when you heat up the body, it becomes more pliable. So before I try to, most of the time, if I can, I try to get my patients to do light cardio before we start stretching and exercising, because I want to increase that body temperature.
I'm almost thinking of come in after a hot bath.
Yeah. So hot bath, sauna, anything where you heat up your body, that would benefit mobility, because you're increasing body temperature, body heat, and that normally will soothe the joints and give them a little bit of pliability. So something that will help you increase your body temperature. Second, whatever area it is, try to move that joint. Try to move that area. Whether it's a stretching exercise or a range of motion exercise. So the difference is, so stretching, I'm taking a muscle and I'm taking it through the end range, and I'm just trying to lift the leg up as high and I'm just trying to stretch my hamstring. But if I have a stiff wrist, I can just begin by doing this circle of the joint and just doing wrist circles. Or if I have an elbow and I do circles, that I am mobilizing the joint. Okay? So doing both of those, it's what's needed. Start by gentle range of motion exercises. So just for the sake of the camera, I'm going to use my wrist. So if I have tight wrists, gentle circles, maybe some flexion extension. And then after I've done a little bit of that, then I can take my wrist and stretch it. And then stretch the forearm muscles by pulling forward and back. So imagine applying that idea to a knee, a hip. So take my knee, my leg, and maybe make some circles with my legs. And then I take my legs straight and then I stretch my hamstrings, or then I bend it the other way and I stretch my quads. So cardiovascular exercise, heat up the body with whatever you can come up with, hot bath, sauna, anything like that. Even a hot pack. Let's say you want to work on your knee. Well, put a hot pack on your knee.
Gotcha.
That'll help. Some sort of range of motion and some sort of flexibility work. And then if you're past that and you're pain-free, and then add some resistance. So body weight resistance exercises. So like a body weight squat or push-up, a seated dip, some sit-ups on the ground, some calf raises, anything that you're moving your body against gravity, that should be able to help you with lack of mobility. And then I guess lastly, I would say whatever functional activity you're trying to get to. So if I'm a golfer that is losing mobility, well, perhaps I just maybe do some some upper body twist in the chair, or stand up and do some mimic the golf swing back and forth with my hands and mobilize my upper back, mobilize my lower back. So find the movement of the activities that you want to get back to and try them. Short range, even if it's short range, maybe you move this much this week, maybe the next week you go this way. And then as you get further along, then maybe you pick up the club and swing some. And so when it comes to lack of mobility, there's plenty that you can do as long as it's not a specific diagnosis like a frozen shoulder or some sort of hip problem or something where it is contraindicated to move that joint.
Interesting. This sounds more like the it's reaffirming, I guess, your last week's live where the one word takeaway would have been like consistency or movement.
Yes.
And yet again, to rid certain types of pain, movement seems to be a key ingredient.
Yeah.
And you know something I'm thinking too while I'm sitting here listening to you, and let me know in the chat if you guys what your opinion might be to this. But when you were talking about an ice pack or maybe hot bath, and I'm thinking bath salts,
Yeah,
I'm almost considering we might need to put together a pain kit.
Yeah.
Just to say what can we do with $20 and run into the store and then relieve this kind of pain or that kind of pain. Yeah. Tell me in the chat if you guys would be interested in a series like that.
Yeah. I mean, like, the stuff that I just talked about does not require any equipment.
Right.
Because you can just use your bath at home, your shower at home. You can walk outside. You can do these exercises in your chair. But there's always, do it yourself, simple remedies you could buy at Walmart, at CVS, or whatever. So one of the things that we're trying to do with this program is give options.
Right.
Shoot out ideas because, like I was explaining to my son today, he got a shot on his shoulder, and the doctor said I was going to feel better in 30 minutes. And today he was still in pain. He's like, "Whoa, Dad, I'm still hurting." Well, I've been around many athletes that shot helped them, and then 2 days they were better. Well, maybe it didn't work on you. I don't know. But was it the right course of action? Yes. Okay, well, perhaps the shot didn't work, so we need to try something else, and we need to kind of explore other options. So my point is that if you try something, it doesn't work, don't dwell on it. Move on. Try something else. Keep pursuing that relief. Keep pursuing function. Keep pursuing your life so that you are not anchored to degenerative disc disease or degenerative so-and-so. If something doesn't work, keep trying. Keep trying. In my opinion, we are all worth trying. Our biggest commodity is our body. And as far as I'm alive and as long as I'm doing this type of work, I'm going to continue to promote fitness, promote movement, try to help people move better, perform better. And so my advice to you is don't give up. Keep pushing. Even if your workout program is this might turn into this. Mm-hmm. And then once you can do this, maybe you can put some weights on your hands, and then maybe you can get a bar. And then I've seen it. I've seen it for many years, how a little bit can turn into a productive lifestyle that is constantly moving well, working out, enjoying family, enjoying work. So degenerative is not the end.
Right. It's like the journey of 1,000 miles starts with the first movement.
Yeah.
Or the journey of standing up starts with the first movement.
Yeah.
The journey of moving your arm like you used to before, it starts with the first movements.
Yeah. Yeah. And we all like Netflix. I'm one that, I'll sit there and binge watch a show all weekend. But when I'm sitting there for an hour and my back starts to hurt, I start feeling a little bit of pain or a little bit of stiffness. I'll cross my legs and I start stretching and moving around, get up as I continue to watch Netflix. Did I, did I do a specific stretching program? No, but I was sitting there for an hour watching Netflix. My body's getting stiff.
Mm-hmm.
My body's telling my brain, hey, you're getting stiff. And I know that right now I have a little bit of low back hip pain. Okay. I know if I sit here and don't move, 3 hours from now, I'm going to be in a lot more pain. But I can stop that pain from getting worse by just taking my leg, stretching my hip, maybe stretching my back, and I keep watching Netflix. And there I go. That was my program. So to me, when it comes to being healthy and fit, it's not always when you go to the gym. It's not always when you decide to exercise. It is a moment by moment awareness of how your body feels. If I feel tight and my shoulder feels tight, okay, well then, I just pull this across and I keep typing on my computer. If my neck feels tight, okay, I'm gonna stop for a second and do maybe some shoulder neck, excuse me, shoulder rolls, some neck rolls, some rotations, maybe some chin tucks. So it's just being fit, being healthy. It's more about a consistent awareness of how your body feels. And I promise you, when you pay attention to your body's always telling you to move. You're stiff. This is hurting again. Don't stay here. But for whatever reason, we ignore it. Years go by, and then we go to the therapist, and and then you tell me you got degenerative disc disease. So this is degenerative anything. It's not a one episode thing. This is an accumulation of years
Of not moving.
In my opinion, I would define degenerative as the accumulation of not moving for years.
Mm-hmm.
Because most of the time when people come to me with that kind of back diagnosis and I ask them their medical history, they usually, the most common thing is that they quit working out in their 30s. They had an injury in their 30s and they had surgery and they never did anything about it after that. They continued to live without any kind of awareness of their bodies, bad diet, smoking. And so 20 years later, well, yeah, you're going to have degenerative disc disease or whatever. So I would say if I'm going to define it, it's the accumulation of not moving for years.
You know what I would also say too? Start looking at the phone ads that you get on like YouTube videos and everywhere else. Because something I'm starting to notice, at least with my phone, if it sits for too long, it's because I've been sitting for too long. And you know what kind of ads I get? Tai Chi movement ads. As if the phone knows that I'm sitting around too much. And obviously, I've put in all my data, my name, my age and whatnot. So I think as well, it's moving me up the recommended ladder of, well, he's this old, so we'll throw him this because 9 times out of 10, he's going to need it.
Mm-hmm. Yeah. Yeah. And, I'm not a fan of getting multiple ads, but I think I would say it's not a bad thing when you're getting fitness ads telling you to move.
Pretty much.
I would say that's not a bad thing. Because, I mean, the signs are everywhere. I think that we live in a society that if there's plenty of information. If you really want to find something, if you really want to get better, it's out there. So our health is about as close to this phone right here, because there's a lot of places where I can go to get information on how to be fit, how to eat, how to sleep, what kind of doctor should I look for, who does what, who specializes in what. So I feel like when it comes to our health, we're getting to the point in society that there's no excuse. Right. Because there's too much information, there's too much technology available. It's easier to get information. When I was younger, if you wanted information, you had to go to a library. Well, now I spend a lot of time on AI asking questions about different things. You know, hey,
Sure,
how do I
sure.
treat this diagnosis? Or tell me the common so and so of this type of condition, and it spits it out in 5 minutes, and I get an idea of what to do, and I move on, and I create exercise programs. People ask me for something generic, and in 2 seconds I can come up with a program for someone that has shoulder pain, back pain, whatever. So I
Yeah.
feel like that today's society, we have everything that we need to be healthy.
I'm gonna say yes, and I'm also gonna say to Kimberly's point here in the chat. She says, "I thought degenerative was mainly from too much movement, which was something that you described as, hey, after 25, you're getting older, so no matter what kind of movement, you're starting to degenerate." I would also argue no movement, you're still degenerating, probably faster.
Yeah. So okay.
So, well, my question would be, where's the line? Where's the limit?
Well, I would say there's no line and there's no limit because degenerative refers to wear and tear. And so we're gonna wear ourselves down whether we do something or not something. Yeah, so like athletes, they get degenerative conditions because they use their shoulder too much. They use their hips too much. A lot of major league pitchers, when they end their careers, they have hip surgeries because they overuse their hips,
Wow.
in pitching. Okay, well, take that to someone that is a non-athlete who just lives life without any fitness, without any without doing
Routine.
anything
Right.
about that. Gravity is always pulling us down. Gravity is always pushing down on our bodies. So if you don't do anything, gravity is going to be putting pressure on our bodies, and it's because we don't do anything, our muscles atrophy, our muscles get weaker, so our posture is going to go forward. And so as we lose our posture and we begin to slouch forward, that starts putting more pressure on the lumbar, on the back joints, and that's why when we all get older, we always end up in that hunchback position because gravity is going to win.
Right.
Whether you work out or don't work out, gravity is going to win. We're all going to end up hunchback and in a degenerative condition. So you can either fight gravity with exercise and try to maintain a good posture, good upright posture, and have a better life, better lifestyle, or you can just let the body do what it does and let gravity take over.
Wow.
And you're eventually going to wear down anyway. So you're going to be degenerative one way or another. My point is, how quick do you want to be degenerative? Do you want to be
Very
degenerative
good
in your
question.
30s? Or do you want to
Right.
be degenerative in your 50s?
I'd say more your 70s.
Or 70s?
Right.
Exactly. So I know 70-year-olds right now that are so fit. I know a 73-year-old woman right now that rides her bike 30 miles a day,
Wow.
4 or 5 days a week. Yeah. But I also know 50-somethings that are so overweight that can barely move. Or people that are so degenerative, whatever, that they don't do anything. And they can't enjoy their kids. They can't enjoy their grandkids. So to me, it's a choice of how quickly do you want to degenerate.
Right. I like that. Appreciate that.
Yeah. Because if there was a line, it'd be easy to treat, but we can't fight aging. That's just Mother Nature. We're all getting older. We're all going to die, and it's just part of life. Degeneration is part of life.
Well, Jose, I really appreciate today's live with you, man. You've really addressed a lot of different solutions to a very degenerative or general diagnosis. And, I'd almost say a second opinion or at least a standoff is at warrant when you hear that. Hey, I have something that's degenerative. Okay, tell me more.
Yes.
Yeah, don't just give me the basics, the overview. Like, let's get specific. Not to say that you should argue with your physician, but it's a standoff.
Yeah.
Now you got to pry into it a lot more, a lot deeper.
Yeah, I think as a patient, to me, you're the consumer.
Mm-hmm.
So if you hear something like that, I think you should have follow up questions. So why do you say that I have a degenerative disc? Explain that to me. And then he should be able to explain that the disc is worn down, the joints are compressing on the nerve, this nerve goes to these muscles, and that's why you're having weakness over here. That's a more comprehensive answer. And
Mm-hmm.
then you understand that degenerative is not the real diagnosis, is this condition that is this joint is putting pressure on my nerve, and my nerves that go to these muscles are being limited, and now I have weakness or have numbness or burning or whatever. So that gives you a better picture of what you're looking at. And so when they come to me or the therapist and they tell me all of that, now I have a bigger picture to go off of. But when somebody tells me I have a degenerative disc, I always have to ask, okay, tell me what levels, what kind of tests have they done? Where's your weakness?
Mm-hmm.
Do you have any burning? Do you have any numbness? Do you have weird sensations anywhere? And then I track that down, obviously, and then start kind of mapping the body. I know that certain areas of the leg might be, different segments of the lumbar spine. And so I start kind of narrowing it down to what level. And then so I kind of know what to do. But like for me as a patient, and that's my job. So to me, I don't mind that questioning and that investigation. But for the patient, I feel like the more you know, the more you understand, the more okay you should be with how to go about it.
Sure.
Because I feel like sometimes people come to me with incomplete information,
Mm-hmm.
and as a patient, the more you know, I think, in most cases, the more you know, the more peace of mind. And I think that because when we're in pain, sometimes we can't get out of that pain cycle. To me, the only relief you might have is, you know what, at least I know that this is treatable, or at least I know that this guy can help me, or at least I know that this is not fatal, or it's not the end of my lifestyle or something. So peace of mind, in my opinion, is a big piece of the beginning of the rehab process.
So check this out. We've got one last question that
Mm-hmm.
came in, and then I'll let you close this out
Okay.
shortly after. So, and thank you for your time. I really love every little bit of time I can spend with you. This is invaluable. You have no idea. But one question came in. Any drop foot help tips?
Yes. So if it's a drop foot from nerve damage, you need to get an orthotic. Ankle foot is called AFO, ankle foot orthosis. So it locks your foot. Well, maybe over here. I can't remember. There you go. It locks your foot at 90 degrees because we at least need 90 degrees as the leg swings through in the leg swings in the gait cycle. If your foot is plantar flexed, you're going to hit your toe and you're going to trip. So you need to be able to dorsiflex the foot to swing it through. So putting an orthotic that locks you in at 90 degrees is a solution. So you need to find a place that makes orthotics.
Gotcha.
This is and this is not an orthotic like an insert orthotic. This is a
Lock boot.
prosthetic orthotic specialty place.
Gotcha.
It's like a plastic brace that goes from like mid calf to mid foot, and then you strap it in the front, and it locks your foot at 90 degrees. That would be because if this is nerve damage and you've had drop foot for a while, you need to have something to keep you at 90. Otherwise, you're gonna be tripping all the time.
Kimberly, I hope you got that. That was for you. She says, thank you so much.
You're welcome. You're welcome.
So 30 seconds. Go
All right,
ahead.
we
And,
got.
oh, yeah.
All right. Okay. So tomorrow, join Katie. She's gonna be covering when metabolic labels hide the real problem. Again, guys, thank you for joining. This is Jose Vazquez for Baseball Strong. Take care.